Hello, my name is Drew Gates. Today we'll be talking about bill number A01032. The purpose of this bill is to discuss the different forms of medical marijuana that can be given to patients in the state of New York. The bill also discusses things such as saying that smoking is the most affordable way of using medical marijuana because it makes it easier to dose the medication. However, it states that other patients don't want the intoxicating feeling that comes with this method, and they would rather be able to take their medication and go on with their day. Today, they also talk about how New York State's medical marijuana program is one of the only programs that prohibits smoking as a method of usage. They also discuss the fact that patients need to carry their medical marijuana card on their person at all times when possessing or purchasing their medicine. Currently, in the state of New York, for to qualify for a medical marijuana card, you have to have a severely debilitating or life-threatening condition. These conditions include ALS, cancer, AIDS, PTSD, etc. The state also recognizes marijuana as a safe alternative to opioids such as fentanyl and hydrocodone. The bill is covered under an umbrella bill called the Compassionate Care Act, bill number A06357E, which was the initial bill that made medical marijuana possible to obtain in the state. Without this act, it would have never been possible to even have such an act as the one mentioned earlier. As of December 2017, medical marijuana products are available in the forms of lozenges, lotions, ointments, chewable tablets, and many, many more. Let this be known, the medical marijuana program is still fairly new in New York, and research is still being held on the medical marijuana as we speak. No matter what type of medical marijuana is available, the main focus of these products is to make people feel more comfortable. It shouldn't be mistaken that medical marijuana is a cure-all, but it does give temporary relief from patients' symptoms. It's simple as that. In the case of cancer patients that are experiencing nausea and vomiting during their chemotherapy, the patients are given various forms of cannabis products, such as cannabis flower and THC liquid. During the study, 15 patients were tested after being treated with large doses of chemotherapy drugs. 14 of the 15 subjects of this particular study didn't experience nausea and vomiting as a result of the marijuana flower and THC liquid. This is a great example because it shows that the medical marijuana makes it easier to go through this treatment for the patients. Along with that, it helps improve their quality of life while they are sick. The current forms of medical marijuana in New York are meant to help with these types of things. These forms of medical marijuana are meant to promote comfort for the patient that takes them. Other illnesses, such as chronic pain, have been proven possible to be alleviated with the use of medical marijuana. In a study done on subjects who were suffering from chronic pain that makes it difficult for them to fall asleep at night and limit their movements, they were given marijuana flower and tincture, a super condensed form of the plant, as a result, the subjects experienced a decrease in their pain and they were able to sleep better at night. This further proves that the use of marijuana for medical purposes promotes the betterment of their way of life. The idea of something so simple can do so much good is amazing. Without the use of these products, the subjects in the studies would be suffering and their quality of life would be possibly get worse. As stated, these are not a cure-all by any means. It usually is used along with the patient's usual drug regimens. In the case with patients with epilepsy, however, sometimes the medicine doesn't exactly work as it's supposed to. In the case with the subject of the next case, whose name is Charlotte, she had upwards of 50 seizures a day. When Charlotte started taking a tincture that contained the medical marijuana along with her normal medications, her seizures dropped to only 2 to 3 a month. The marijuana did not cure her disease, but it raised her quality of life. As mentioned previously, the program is still very new, but with the support with the support of the state's government, we should see the program grow. And we'll see more conditions added to the list, and we'll see more people get the relief they need. Thank you.